Hi everyone, my name is Jessica Grimes, and for my Capstone project, I'm going to be talking about how we as nurses can work on reducing pressure ulcer incidents in our immobilized patients. For this presentation, we'll be comparing 2-hour repositioning with low air loss mattress surfaces. Alright, so let's start this off with what you'll walk away with today. This presentation helps you understand why pressure ulcers matter in immobile adults and compares two major prevention methods. These two methods are repositioning and low air loss mattresses. We will explore the clinical evidence behind each and examine how they affect workflow, staffing, and even budget. The goal here today is to leave this presentation with real insight into which strategy works best and how we as nurses can use it to improve care and outcomes for these patients. Okay, so the rationale and purpose of this presentation. I chose this topic because I see this problem firsthand. Working on my current floor, I work on a stroke floor. It's also a med-surg floor. These patients are high risk for pressure ulcers. Every year, 2.5 million patients develop pressure ulcers, causing pain, longer hospital stays, and higher costs. In fact, CMS stopped paying for stage 3 and stage 4 pressure ulcers back in 2008, which makes prevention not just a clinical issue, but a financial issue as well. Repositioning patients every 2 hours has been a long-standing nursing standard, but the reality is when things get hectic, it's not always followed. That's where these low air loss mattresses come into play. They're built to redistribute pressure and reduce moisture, which is essential for ulcer prevention. Even with strong protocols, ulcers still show up, likely due to inconsistent adherence and even staffing shortages. This project helps us explore whether low air loss surfaces might provide a more consistent safety net rather than just turning a patient every 2 hours. So the Pitcott statement for this project, I use the Pitcott question: in immobile hospitalized adults, does repositioning every 2 hours reduce pressure ulcers more effectively than using a low air loss mattress without the repositioning? The population here is going to be our immobile adults. The intervention is, of course, the repositioning, and comparison is low air loss mattresses. Our outcome is going to be our ulcer prevention. Our goal here is to see which method produces better results under real-world floor conditions. Our target goal here is to have a 30% reduction in new pressure ulcer cases over a 6 to 8 week period. We'll be using the Braden score to scale these patients. And these patients are going to consist of our immobile patients that are immobile 80% of the day. So, literature review for this project. Research supports both of these methods. The team-up trial found that scheduled turning every 2 hours reduces ulcers. Low air loss mattresses have also shown to reduce incidence and healing time. However, most studies use both strategies together, so it's hard to isolate the effect of just one of these strategies. With this project, it aims to separate the two and analyze their independent impacts. That gap in literature is what makes this project relevant. This project brings together nurses, wound care, finance, and even the patient, of course. Everyone has a stake in pressure ulcer prevention. Some of these barriers include limited availability of low air loss mattresses and resistance to this change. This plan focuses on integrating both education for not only the patient but family members as well, and practical workflow designed to make it easier for nurses to follow these protocols. Everyone wants what's best for the patient, but expectations need to be managed when resources are tight. Implementation strategy for this project. Implementation will take place on a medical surgical unit, splitting these patients between a repositioning group, so this group will be turned every 2 hours, and then the low air loss mattress group, which won't be turned every 2 hours because we're comparing the two, but the low air loss mattress group without the turns. So nurses will receive training on proper documentation and ulcer prevention prior to starting this project. And of course, we expect some resistance because no one likes change during a busy 12-hour shift. But with support, education, and clear communication, it'll help ease this transition. This strategy was chosen because it reflects a real clinical setting and not just a lab environment. In order to evaluate this project, outcomes will be tracked through chart audits and also confirmed by wound care specialists to ensure this accuracy. We will also survey nurses to understand how the intervention affected their workflow during, let's just say, a 12-hour shift. This mixed method evaluation, which includes quantitative and qualitative data, ensures we're not just counting ulcers and counting chart audits. We're listening to the frontline staff, which would be the nurses who are dealing with these patients hands-on and who are going to carry out these protocols every day for this project. So findings after this project is completed will be shared through staff meetings, unit presentations, infographics, and possibly published in nursing journals. A big focus will be making the data digestible for frontline staff. Infographics, not long reports, will help drive engagement. If the results are strong from this project, this could support policy changes and even new standard practices. I'd also look into earning CEUs for this topic through my hospital's education department or local professional nursing groups. In closing, this capstone compares two well-known pressure ulcer prevention strategies: turning every 2 hours and low air loss mattresses. By identifying which is more effective and practical, we can help improve care, reduce healthcare costs, and better support our nursing staff. It's all about evidence-based practice applied to a real-world challenge. So that's the end of my project. Thank you everyone for watching. If you have any questions about this capstone project or any feedback, please leave a comment in the discussion board, and thank you for watching.